For JR, a simple walk from his house to the end of the driveway was a monumental task.
As soon as I got there, halfway, 35, 40 feet from the garage to the end of the driveway, I'd be shot. And then I'd hurt for days on end because it just hurt so bad in my knees. I was so heavy.
JR needed a double knee replacement, but because he was overweight, he wasn't eligible for surgery.
It's because if surgery is offered when a patient has a significantly unhealthy weight, we can make them worse. And the catch-22 between I can't exercise because my knees hurt so bad, so therefore I can't lose weight, it's one of the hardest things to get out of that the patient and the surgeon can experience.
It's all a big circle because it hurt so bad to exercise that you couldn't exercise. So then you just sat around, and it just was a big circle. I had to do it on a time frame.
JR found a way to break that circle at the osteoarthritis clinic at UW Health.
They've tried to lose weight their whole life, right? And so they're here and they're like, well, okay, but I can't lose weight because I've tried, and now what do I do?
I was so negative that I was basically looking at them and saying, you think I'm going to lose weight? Have fun, because it's not going to work.
You should feel a stretch in your knees.
But JR quickly realized the osteoarthritis clinic had a plan that would work. It's one of the first places in the country to offer a multidisciplinary approach at each visit.
Patients really benefit from the whole team approach. So they hear similar messages from all members of the team, they get unique expertise, and they can get it all in one place.
JR's team included a medical doctor, physician's assistant, nutritionist, and physical therapist.
How are things going?
We're going to ask you to do things that you may not have done in a while, like work on weight loss, change the way you're eating, and exercise for maybe the first time in years.
So we'll have you write down what you're eating and drinking.
We'll work with them to decide lifestyle modification, which lifestyle changes they're willing to make.
Yeah, perfect.
With each patient, it's about finding things that they want to do in their daily life and then teaching them that we can break down those activities to smaller, more manageable pieces.
First time I was there, I sat in a chair just like this, and they said, all right, from right where you're at right now, stand up and sit down as many times as you can in 30 seconds. I did 6.
But JR followed the exercise and diet plan of caregivers, and the weight came off. In 7 months, he dropped 117 pounds.
6 months after I started, I did the sit-down, stand-up thing. I did 29 times in 30 seconds.
By late September of 2019, JR was ready for Dr. Squire to perform a double knee replacement surgery. And by November, JR was not only walking, but climbing up his tree stand during the deer gun hunting season.
I get into my tree stand without crutches, without anything else, and I made the whole work, and I did it every day of the 9-day season, and I didn't have any issues, and that for me was huge.
He was bordering on immobile prior to the surgery. Now we've returned him to a lot of activities that were unattainable before.
I feel like I got a new lease on life. I really do.